Yes, 101.1 FM and AM 1160. Good morning to you. Our conversation this morning with Whitney Hill, brought to you by Marcus and Mack, a law firm representing injured people. Did I get it right, Whitney? Is that your married name?
Yeah, that's correct.
Okay. Because I never know. I can't keep track of the Glasser girls. It's hard. It's hard, but it's good to see you.
Yeah, good to see you again.
You are a CRNP. What is that?
Yeah, so it's a certified registered nurse practitioner.
Mm-hmm.
I'm in a primary care office, so I see patients 12 years and older, and I'm out in Plumville, PA.
In Plumville, at the Plumville, what's it called? The clinic? Is that what it is, technically?
Yeah, we call it Plumville Family Medicine,
Okay.
but yeah, it's a nice little office, and there's another provider, Carmen Buggy, there as well.
Hmm.
So
So that's what you're doing these days, and
yeah.
and that's an interesting community in which to practice because that's a really diverse community. You've got all kinds of different folks coming in, including, I would assume, you get some from the Amish community that come in from time to time.
Yeah, so we're real close to Smicksburg there, and
Hmm.
we do see some Amish patients. And I love being in Plumville because, I'm a Marion Center girl, so
Yeah,
it's nice to be able to go back and serve the community that I grew up in. So
yeah.
it's nice.
All right. Well, tell me about what you do there, and in particular, I want to focus upon primary care physician care because that's really important, isn't it?
Yeah, so it's important for everyone to at least have an annual exam with a primary care physician. In that visit, we can screen for preventative diseases. There's a lot of screenings we can do in the office, such as blood pressure screening, depression screening, screening for obesity or tobacco or alcohol misuse.
Hmm.
We can manage chronic conditions such as like asthma, or we can, see people for acute visits for fever or anything like that.
Yeah.
So,
But that's really a foundation, isn't it, a PCP?
yeah, it is. And with us being able to see patients regularly, it helps us when they do come in for problem visits because we're able to see them at their baseline
Hmm.
and kind of trend their progress over time. So, the continuity of care is a huge part of healthcare.
Okay, so if we're thinking about, say, a woman in her 40s or early 50s, for instance, we'll just take an example. That woman is going to have certain things that you're looking for as opposed to a guy in his 20s or somebody who happens to be in their 70s or 80s. Do you actually break it down in that way? Okay, here comes this woman in her 40s, early 50s. This is what I want to look for that person.
Yeah. So first, a lot of the screening is by gender, and then it can be broken down into age group, and then we look at also risk factors for diseases, and then we also look over family history to see if they might be at higher risk for certain things. So there's a lot that goes into when we do the screenings, but it's definitely important because a lot of the preventative screenings, such as things for colon cancer, breast cancer, those occur before you have any symptoms. So uh,
Mm,
it's very treatable if it can be detected early.
yeah, and those tests are not complicated tests to do.
Not generally, no.
Yeah.
I think that for a lot of people, it's, time is the biggest issue. And we try to take that into consideration. We wouldn't want you to get anything that wouldn't be worth your time.
Hmm.
But it's definitely worth it if you think of how treatable a disease could be if it's caught early. So it's just
Hmm.
important to take that day off and go get your mammogram or, take the day off, go get your colonoscopy.
Yeah, yeah, absolutely. So mammogram, of course, and for men, prostate. Those are things that you'll screen for in typical settings. Um, and then those common tests that we all must have. The colonoscopy is a really big one because, as Dr. Clark has come in and told us about quite often, that's 100% colon cancer is 100% preventable by catching those polyps.
Yeah, it's huge. I mean, um, so just taking the time to do things to get your screenings, and that's why we like to see you in the office regularly as
Mhm.
patients. Like you might think, well, I feel fine, there's no reason to go, but it's definitely a huge thing for us to be able to get eyes on you, get your vitals, look over
Yeah.
your medications, your immunizations, and just review your family history and everything.
Tell me about because you said age 12 and up. Tell me about adolescent kids, kids in their teens, and the things that you look for in children.
Yeah, so in adolescence, a lot of times the parents come with them to their visit and will ask any concerns from you, and we ask mom or dad or whoever else is there any concerns from the parent. A lot goes into an adolescent visit. We look at how they're doing in school, if there's any bullying. We go into if they are sleeping okay at night, how much screen time they they
Yeah.
use a day, which
Hmm.
is recommended less than 2 hours per day, which is
Before breakfast, basically.
yeah, yeah, exactly. That's a lot of times when I get when I ask, but we're all guilty of it, even as adults, just spending way too much time on our phones.
Hmm.
But yeah, and just looking at tobacco, alcohol, drug use,
Yeah.
vaping, asking about if are they using their seatbelt, just a lot of safety things
Yeah.
to cover in an adolescent visit.
A lot of development things too,
Yeah,
as well. Is
for
everything
sure.
developing as it should? One of the things you mentioned, and you sort of alluded to it when talking about the kids as well, was screening for depression. Um, as a primary care physician or in that position as a CRNP, that's not something that I or somebody might typically think you would get for a PCP visit, but that's really important.
Yeah, it's become a huge part of every person's visit when they come through the door is there's at least two questions that are asked pertaining to depression, and if those screen positive, you'll get a 9 question questionnaire. And mental health is definitely a huge thing today in our community, everywhere across the United States, and it's just as important as treating as a physical condition.
Hmm.
So. We just want to make sure people are doing well, not only physically, but mentally and psychologically. So it's a lot of times things people don't want to talk about. So it's definitely your primary care doctor, though, is the safest, is a safe place, and everything's kept
Yeah.
confidential. So
Yeah, and then the coordination with other offices, with specialists that you might have to send someone to for this thing that was detected through their PCP annual visit. Okay, this is something you need to go see this person and get this checked out. That's another vital link that a PCP provides.
yeah, and the Indiana Physician Group's done a great job at having so many services that we're able to, make referrals within the group, and it's a lot easier that way to just communicate with the other providers, and it ensures that we're able to follow up correctly on the findings that the specialist found. But sometimes there are cases where they're referred out, and we still, as primary care providers, it's our job to get those reports and follow up with our patients on what the specialist told them.
Whitney Hill is our guest, CRNP working out of the Plumville office, and we're talking about PCP visits, the annual visits to the doctor that people put off. And I know that you get those people that you have to really, really urge to come in, and you see them out and about in the community, and it's probably one of those situations where, all right, you have, since you're a local girl. Uh,
Yeah.
you have watched me grow up, and you've been someone that's been there for me as I grew up. Now it's my turn to be there for you. Do you ever turn that around on people that way?
Not
Would you like
necessarily.
to start?
uh,
Go ahead and start doing that for me. Guilt them into coming.
oh boy, whatever it takes, I guess. We just want people to be as healthy as they can be, We want people to be able to enjoy their life and have a good quality of life. So,
Yeah, yeah.
yeah.
But they are people that come in every once in a while that I'm sure that when you were a little girl, you knew them as one of the adults that you saw around, maybe parents of some of the people you went to school with.
Yeah, yeah, that's definitely happens, and I love that because the relationship's already been established there. They know me, I know them. So,
Hmm.
and it's nice I'd hope they'd be more comfortable around me
Yeah,
that way. And um yeah, so it's definitely nice to be serving my community. This is something I've always wanted to do. So,
yeah.
dream
And
come true.
being there in your home community, it's a real trust issue too. People need to trust.
Yeah, that's definitely huge
Yeah.
in healthcare. And like I said, the confidentiality thing too, I think is so huge. Just
Hmm.
knowing that they feel safe sharing anything, and knowing that,
Hmm.
with HIPAA, that would never leave the office visit. So
Yeah. Now, there's been a surge in coronavirus concerns, COVID-19 concerns recently, and it's really making a bit of a comeback right now. What are you recommending for people who come to visit your office or any medical office?
yeah, so we do permit people to get the vaccine, 12 and older. So I know that IPG has the Indiana Physician Group has a ton of vaccine clinics. Like if you just go online, in the upper right hand corner, you can see the vaccine tab, and there's a lot of where you just walk in. You don't even have to have an appointment.
Yeah.
So I think the getting the vaccine is a huge thing. And if you're not going to be getting the vaccine, it really is important to be wearing your mask and being diligent with hand washing and maintaining your distance just until
Yeah.
things get under control. Because I came from the ICU and in Indiana Hospital, and it's 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 different when you're on the inside
Sure.
of those walls. It's
Yeah.
it's easy to forget, even myself, like being removed from the ICU. It's life just goes on, and you don't realize like people are critically sick with this.
Yeah.
So
Yeah. Do you recommend people right now coming to the office be masked up?
yeah, we are requiring everyone to wear a mask.
Okay.
So
All
yeah.
right. So if somebody wants to come to the Plumville office and make an appointment and finally do what you've been urging them to, and so have their wives and their husbands and their parents and everybody else, and start those annual visits with a PCP, what do they need to do?
Yeah, so you can call our office at our direct line, and the number is 724-397-9008. We'd love to see you, make an appointment. Like I said, the other provider there is Carmen Buggy, and we would be so happy to treat you, and we're accepting new patients.
There
So
you go.
yeah,
Absolutely. She's Whitney Hill, CRNP. We know her. And
thanks, Todd.
my pleasure. Thank you for coming in. By the way, irmc.org/vaccine, or just go to irmc.org. And as Whitney said, click in that upper right-hand corner and you'll find out where the next of the free vaccine clinics is going to be held. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.